Latest updates on some medical marvel from the state of Delhi. Yesterday, a miracle happened when a team of doctors from AIIMS Delhi successfully performed a complex surgery on a grape-sized heart of a fetus and reshaped it inside a mother's womb. Now, it was 90-second surgery and was a successful one. CNN News 18's Shireen Elizabeth spoke to two of the doctors, Dr. Aparna and Professor Vatsala of AIIMS, who along with the team performed this miraculous procedure. Listen in.
If you could tell us, our viewers, what exactly was the situation of the child? What is the condition that the child was in?
So this baby was around 7 months of pregnancy, and this baby, normally the baby's heart has 4 chambers, and there are 2 outflows which are going out of the heart. And one of the outflows was narrow, right? So the blood was not able to flow out of the heart. And if that condition is allowed to progress, so one of the chambers of the heart, which is the main chamber called the left ventricle of the heart, it becomes very small. And in such a situation, the baby cannot survive outside once the baby is born. When the baby is inside the mother, everything is supplied by the mother. But once the baby comes out, the baby cannot live. So it's like 100% survival. Like the baby does not have a survival outside. So we had to do something about it.
If I ask Professor Vatsala, what really, when we talk about the baby, the condition, of course, we have been told, but Dr. Vatsala, if you could tell us that, was it really one-of-a-kind surgery? Has it been done before? What is the surgery really called? What is the process really called?
So like Dr. Aparna said, one of the valves was not working. It was like the aortic valve. So it is the left ventricle pumps the blood into the whole of the body. So if this valve is not working, the blood will not flow out. And inside, when the baby is in the mother's womb, the mother takes care of that circulation. But if the baby is born, the baby will not survive because the blood doesn't flow to the rest of the body. So that valve is narrow. So that has to be opened up so that the left ventricle also grows. Otherwise, it will not grow and it will become sort of dysfunctional. It will not work after the baby is born. So for this, it's like not that every case you can do. So you have to get at the right time also that the heart is like the left ventricle of the baby is still working, is still in a condition that it's salvageable. Otherwise, if it is already very bad, it's no point doing the procedure.
So this is completely a multidisciplinary team management. So we had meetings before the actual procedure to plan out how we are going to go about. So we planned the procedure once, but things did not work out. So again, the second sitting, we planned that, okay, everything has to be very ideal. Now, it is a procedure in which we have to take a needle and we go through the mother's abdomen. Okay. Then we go through the uterus. Uterus is the baby, the womb, right? So through the skin of the mother, through the uterus, which is the womb, and through the baby into the baby's heart. So till the point that we reach the baby's heart, the needle is guided by us because we are used to going through that part. We are used to the baby. Now, once we are into the fetal heart, now that area is the area of the cardiologist. So we hand over that needle to our cardiologist. Now, then they will put in a balloon which goes across into the fetal heart, into the baby's heart, and it will dilate. That means it will increase the size of the valve.
What was the thing that was going on in the team's mind, in your mind?
I think
we'll start with you. Yeah.
Actually, it was a lot of preparation, a lot of discussion among ourselves, even talking to the patient, doing mock drills, so that everything goes. And luckily, the position and everything was correct. And all of us were having our heartbeats were racing, actually. We all had a finger crossed that it works out.
The moment we entered the heart, the baby's heart actually stopped for a few seconds and our heart stopped. And it is very, very, it can happen and it did come back. But for that few seconds, even our heart stopped. And we know that this happened. But I think everything went well and we kept our fingers crossed. So that was fine.